So, hello everyone. I am VC Sridharan, Assistant Professor from the SNS College of Physiotherapy. So, in this video, we're going to see about the topic which is known as the hydrocollateral pack therapy, which is comes under the electrotherapy. So, what is hydrocollateral pack? It is nothing but a canvas bag filled with the bentonite or the highly hydrophilic silicate gel. These packs are stored with the heat, especially in the hydrocollateral unit, maintaining the consistent therapeutic temperature for the rate of 160 degree Fahrenheit to 165 degree Fahrenheit. So this heat retention and the sizes are remarkably, the packs can be retain the therapeutic temperature for up to 20 to 30 minutes after the removal from the unit. They come in the various sizes to accommodate the different parts of the body, including the standard 10 to 12 inches. So oversized and the cervical and the specialized in the spinal variations, ensuring the versatile applications. So mechanism of heat transfer, how these hydrocollateral bags transfer their heat from to the body. So through these kind of mechanisms, they are conduction. So conduction is nothing but the primary mode of heat transfer, which the heat flows directly from the warmer pack to the cooler body tissues upon the contact. Next, high specific heat. The water and the bentonite gel possesses high specific heat, enabling them to store a significant amount of thermal energy and release it slowly over the time. The latent heat. As the gel within the pack cools, it undergoes a specific change, releasing the additional latent heat of crystallization, which prolongs for the therapeutic warmth. And then the temperature gradient. Heat naturally moves down the temperature gradient from the high temperature of the packs, so to the lower skin temperature, facilitating the effective tissue heating. Next, we're going to see about the physiological effects of the hydrocollateral pack. So, the major physiological effects for this hydrocollateral pack is first one, vasodilation. So, applying this kind of heating modality over the patients may increases the blood flow to the treated area by the 1.5 to 2 times within the 10 minutes. Second one, pain relief. This heat elevates the pain threshold by 1 to 2 degrees Celsius and activate the nerve fibers, supports the gate control theory of the pain modulation, which provides the significant relief. Third one, it is the muscle relaxation. By decreasing the muscle spindle activity, the hydrocollateral packs can reduce the muscle spasm by 20 to 30 percentage, promoting a more relaxed state in the affected muscles. And the final one is tissue extensibility. So heating tissues of the 104 degree to 113 degree Fahrenheit increases the collagen extensibility by the 5 to 10 percentage, making tissues more pliable and responsive to the stretching and the mobilization. So now we're going to see about the indications for these hydrocollateral pack. So the hydrocollateral pack are prominently used for the conditions in the muscle spasm conditions, chronic pain conditions, joint stiffness conditions, and also prior to the exercises. So now we're going to see about the contraindications for this hydrocollateral pack. So in the acute injury and the inflammatory conditions, we have to avoid this hydrocollateral pack. If the person has been impaired sensation, we have to respond, or we have do not prescribe this hydrocollateral pack. Then vascular insufficiency patient, malignancy patients, open wound patients. These are the conditions where the contraindications for the hydrocollateral pack. So application procedure, the first before applying the hydrocollateral pack, we have to first inspect the skin. Always begin with thorough visual inspection of the patient's skin and perform sensation test to ensure the safety. Second, we have to the layering. Wrap the hydrocollateral pack in the 6 to 8 layers of toweling. This is the crucial for insulation and preventing the burns. Duration for this condition is generally for the any conditions there is a duration for up to 15 to 20 minutes. Note that the maximum therapeutic effect is typically achieved within the first 10 minutes of the application. And after the application, we have to monitor the area we have been applied. Check the patient's skin after the initial 5 minutes of any signs of the excessive redness, such as nothing but the erythema. Erythema is nothing but the superficial redness over the skin, and the blistering, it is in a small pus-like cyst-like structure that formed over the superficial the skin due to the heating. And finally, the post application, after applied, we have to remove the hydrocollateral pad and reassess the skin, whether they have any contraindications, whether they have shows the signs such as erythema or blisters. And then we have to encourage immediate active range of motion exercises to increase the range of motion in the affected joint surfaces or the affected region, or gently we have to stretching exercises to maximize the therapeutic effects. So this is the overall view for the hydrocollateral path. So we going to see about the next topic on the next video. Thank you.